I am Elliot Block. I'm the Research Fellow and Director of Technology at Arm & Hammer Animal Nutrition. Okay, we conducted some research out at Washington State University looking at dietary minerals in general and their adequacy versus how much is excreted in the milk, feces, and urine. One of the outcomes of that research was that we found that dietary potassium, is in a deficit situation for much of the very early lactation stage. In other words, that if you feed normal, what we call NRC requirement levels of 1.2% of the dry matter or thereabouts, based on the intake of the potassium, there is more that is excreted through milk, feces, and urine than the animal takes in. So that would be considered a deficiency. Well, it's important because outside of the whole DCAD concept, potassium and minerals in general have specific requirements, mainly to keep the animal functioning, cellular metabolism, etc. Having these lower levels or deficient levels, deficit levels, may not cause an outward deficiency where the animal would get sick, but can certainly underperform in trying to maintain her, in this case, potassium balance. We haven't titrated exactly how much the cows should be getting. We know that it's going to be higher than the 1.2 that's currently recommended. 1.8 is probably closer to what they would need in the very early stages of lactation, and 1.6 would probably be to mid to late lactation as a requirement, as a percent of the ration dry matter. Oh yes, for these postpartum transition cows, I've seen many more rations that could use the increase above the requirement levels in what's currently being fed.